everyone. Welcome to Medical Mondays. Welcome to an exciting topic, a topic that we all need to know about, a pandemic that has been plaguing us. But before we start, I'd like to introduce myself. I'm Dr. Toyin Okwesomi, a family practitioner, HIV specialist, and I do treat addictions. I'm in Maryland and work across Maryland. My passion, though, is helping to bridge health disparities, giving out current and informed information related to health. And that's the passion of most of us in this fair, in this space. So we come together once a week, every Monday night, as you know, to just come chat on medical issues. So today we have our amazing Dr. Kindred, who is going to talk to us about the pandemic that I just mentioned. I will let her go into details of that. But Dr. Kindred, Dr. Chesahna Kindred, is a physician who is board certified in dermatology. She treats patients of all ages, skin types, disorders, and conditions. She specializes in hair and scalp disorders, including traumatic hair loss and conditions that disproportionately affect patients with skin of color. Dr. Kindred is the founder of the Kindred Hair and Skin Center, servicing the Baltimore metropolitan area, where she provides cutting-edge treatments for disorders of the skin, traumatic hair loss, and cosmetic dermatology. In addition to her private practice, Dr. Kindred founded the Onyx Medical Society and is the chair of the National Medical Association, the dermatology division of it, where she leads initiatives that address the healthcare disparities within the clinical research performed, which is pivotal to adequately providing treatment in people of color. She has contributed to multiple publications for organizations such as the American Dermatology Association. She created a digital series called Derma Myth, where she debunks popular myths heralded throughout the dermatology industry from both patients and practitioners, which birthed a first self-published book titled Derma Myth: Breaking the Cycle of Skincare Myths. She's a global pioneer in the field of dermatology. She's a mentor, an advocate, and contributor to the advancement of all that has to do with derm. Aren't we blessed and privileged to have her tonight to ourselves on Medical Mondays? So I welcome Dr. Kindred.
Thank you, Dr. O. Thank you, AJ, for the invitation. I think I need to have you write all my bios. That was great. I was listening like I was a guest as well.
Look, I got help from AJ, from
okay.
Ephraim, Dr. Ephraim Ajay. He gave me all this help. So I thank him.
Well, thank you, AJ.
And thank you for coming. So I'll leave the floor to you.
Thank you. So we're going to talk about hair loss and just a huge epidemic of hair loss that exists, particularly amongst Blacks. And I do mean like all Blacks. Those of us descended, Black Americans, Nigerians, Ghanaians, Cameroonians, I'm seeing it across the board. So that should tell you part of it's genetic. All hair loss isn't the same, even though it looks the same. So I need to use like a visual aid. And so I'm going to share my screen and I'm going to give you a nice brief 10-minute overview of the common forms of hair loss. And Dr. O, once again, thank you for the invitation. We're going to start with the first one, which is central centrifugal cicatricial alopecia. And one way to tell is part your hair down the center, and it should look almost like a shiny Christmas tree. So central in that it likes to start at the center of the scalp. Centrifugal in that it'll start small and then spread. Cicatricial in that it can lead to permanent scarring. And then alopecia, which just means hair loss. And if we take all 15 forms of hair loss, add them up, there are still more Blacks with CCCA than all other forms of hair loss combined. So just how it develops is genetic. And that's what I need us to understand, because we do a lot of victim blaming. We say, oh, she has hair loss because she wore a weave or she wore tight braids. A lot of times a sister is wearing a weave or braids, whatever, to hide this genetic form of hair loss. And it's a gene that encodes an enzyme that's responsible for shaping the proteins that form the hair. And the reason why there's no cure is we're not going to do any gene modification on you, right? And if someone offered it, tell them no. The enzyme is responsible for shaping the proteins that make the hair strand. So if that enzyme is messed up, it messes up the way the hair strand is formed. Now you have a bad product. And as far as your body is concerned, your immune system is doing the right thing and flooding your scalp with inflammation. So that the way to know if one of the 15 forms of hair loss is the one that we suffer from is if you feel tenderness, burning sensation, itching not related to flaking or dandruff, sometimes pain that wakes you up in the middle of the night. If that's the case, and particularly in the center, then that's CCCA. So here's a case of our patients. This is the one that I showed towards the beginning. And then you can see the area of hair loss involvement. We then treated her, and she went from this to this. Now, any dermatologist would be very proud of this, especially that this occurred in less than 6 months. I think it was about 4 months in. But you still see this bald spot. She is still going to wear her wig, right? Well, I'm the first dermatologist in the nation to have a full service hair salon in-house. And what the stylist did was she styled it in such a way that she ended up coming out of her wig that day. And if you look, she has on the same shirt. So I really, really believe in the collaboration between stylists and dermatologists. It's like an orthopedic surgeon and physical therapist, or endocrinologist and dietitian, so on and so forth. And it's and that partnership, particularly of having her in the office, has made a huge difference for patients. So this is Susan, the stylist, that joins me in tag teaming with our patients. I don't want you guys to delay until there's a huge bald spot. And that's the other importance about stylists, is they'll catch it a lot earlier. And our treatments are much more effective if we catch the hair loss early on. So if you see this young lady, this was actually her before picture, and this is her after picture, because we caught her early enough to make that intervention. And we're going to go next to female pattern hair loss. And female pattern hair loss and CCCA can look identical. I'm not of the school of thought that all Black women have CCCA or all Black men have male pattern hair loss. So for every patient, I biopsy them. And it has different names: female pattern hair loss, male pattern hair loss, androgenetic alopecia, androgenic alopecia. This is the most common form of hair loss in the world. And I think one of the reasons why we're seeing a pandemic is I'm seeing tons of patients with both. And how unfair is that? They have CCCA, most common in Blacks, and androgenetic, most common in the world, a lot of time. A real uphill battle for some of our patients. And the source of this one is our own testosterone is miniaturizing these hair. You see this nice, healthy follicle here, nice, healthy follicle making a nice, strong, healthy hair. And then you see how some of her hairs are getting thinner and thinner and thinner. So you barely have any. This one is on its last leg. I give her another month before this one is gone. And then you'll just have just a bald area where there's no hair. Like this whole zone right here is devoid of even follicles. We want to catch you before then. So this is an example of a patient with female pattern hair loss, androgenetic alopecia, male pattern hair loss. And we caught her early enough to where we were able to bring a lot of her hair back. Traction alopecia is the third most common one I see in Blacks. And it's because our culture is a little bit too obsessed with neat edges, at least in the US. And that is tight ponytails, braids that are too tight, wearing a weave for a long time, just not letting our hair be. So the key for that is caused by tension, right? So you have your follicle pulling your hair one way and the hairstyle pulling the hair another way. Eventually, it's going to be ripped right out of the scalp. And then as I wrap up, I want to point out treatment isn't easy. Like we take hair loss very, very seriously. Hair loss has to be respected. And we do things that we call grow, things in the category of grow. There's minoxidil, right? You could buy that over the counter. That's Rogaine. But before you run out and buy minoxidil, I want you to know that once you start it, you're locked in for the rest of your life. It works. It's cheap. We prescribe higher doses than what's available over the counter. We even prescribe the pill. But I have never been able to switch somebody off of minoxidil. So sometimes it's better to just take a loss and not start it than to start it and then stop it eventually. There are 2 natural supplements that actually help the hair to grow. It is not biotin. And then we have a shampoo in our office that helps the hair to grow. Under wellness, it's our natural hair salon. We also do, using artificial intelligence, calculate the density of the hair follicles. So say, for example, a patient is combing her hair and she just sees a whole ball of hair in her comb. She can run into the office. We can do a hair density check. If it's worse, we can step up our game and add a treatment. If not, she goes home with a peace of mind. And then a discussion group. I know all of you guys on here knows how therapeutic discussion groups are. And then if inflammation are involved, we use cortisones, topical cortisones, injections, and anti-inflammatory medications by mouth. So this is what we consider standard. Once we have this underway, then we whip out some of our fancy schmancy stuff. We got a lot of fancy stuff in our office. And what we're caught up with is, especially with addressing disparities, is a lot of these technologies will come out and they're great and they're outstanding, but they were only tested, and I'm being very frank, they were only tested on middle-aged white men. So what does that mean for women? What does it mean for my young people? What does it mean for Blacks, Latinx, Pakistani, Hindi, etc.? And so in our office, we offer it because we believe everyone deserves that cutting edge technology. And a lot of the patients you saw earlier, the before and afters, involve something cutting edge. So we do a procedure where we suction out the gunk out of the follicles. That's dead skin and yeast and hair grease and hair products. And then we have a nice clean pour, and then we squirt in follicles. We also use platelet-rich fibrin matrix, or we draw your blood, and in your platelets, they have these healing chemicals called growth factors. And then we inject those into the scalp, and it repairs any damaged follicles. We use lasers, we use stem cell technology or exosomes. Last resort always is hair transplantation, and then even micropigmentation, where we kind of tattoo in a bald spot to fill it in. So I know we're about to jump over to question and answer, but that was just a little bit of fodder. That was just, planting some seeds in, because I understand that the question and answer part of Dr. O's sessions are by far the best.
I have to clap for that. Thank you so much. Thank you. So, awesome presentation. question and answer session. I want to ask my question first. There are tons of questions in the chat box already.
Ah,
So
okay.
I want to go first. If you know, I want to ask about this male baldness. When I was growing up, men started getting bald when they are much older. Men will get bald. Now I'm seeing men in the 20s, early 30s, getting bald. Why is that? And what can we do about it?
I do think that CCCA, the first one that that I covered, and now that we discovered the gene, and it was a dermatologist, Dr. Deloba in South Africa, and one right here in North Carolina, and they worked with a group out in Israel, and they figured it out. That gene has an autosomal dominant inheritance, and which means it hits every generation, but it's getting worse with each generation. So while the grandfather maybe kicked in their 70s, the father is kicking in their 50s, the son is kicking in their 20s, and we're seeing it with women too. It's kicking in faster, and it's getting more severe at a younger age. And that's what's so important about spreading awareness, because if we don't have access to dermatologists that specialize in hair loss and know our hair and skin, then it's allowed to create just permanent destruction of the follicle. Then there's less we're able to recover. Wow. Because it's autosomal dominant and it's getting worse with each generation. This is a short answer.
Got you. That makes a lot of sense. Mm-hmm. So somebody asked in the chat box, what happens when you stop taking minoxidil? Will your hair fall out again?
So yeah, the hair falls out and then some. So if we take, for example, those natural supplements that I mentioned, let's say you're here with your hair loss. You start the natural supplements, you improve. If you start minoxidil, you improve, but a bit more, assuming you're getting a prescription version. If you stop the supplements, you lose your progress. If you stop the minoxidil, you lose your progress and then some, is what we found. So if a patient doesn't convince me they're going to stick with it for the rest of their life, I don't prescribe it, because there's other stuff we can do. We have a dozen other treatments. So yeah, you lose the progress plus more is what we've seen in our office.
Wow. So a follow-up question to that is, what are the side effects of a larger dose of minoxidil?
Mm-hmm. So with the smaller dose and larger dose, you could possibly get facial hair. I have not had a single man complain about facial hair, and half of my women complain about facial hair, and I can't predict who's going to have it and who isn't. And when you have it, it's usually temporary. And I see it more with the topical prescription or the topical over-the-counter one than I do with the pill for some reason. Now with the pill, that's actually a blood pressure medication that I'm sure for all the primary care docs know wasn't that impressive of a high blood pressure medication. And we don't need the antihypertensive dose. We don't need the full dose that's typically needed to control high blood pressure. A lot of my cardiologists, family medicine docs, etc., said that if back years ago when they prescribed it, a lot of times their patients had to be on 10 milligrams. We don't go past 5 milligrams. And a lot of our patients are on 2.5 milligrams or a quarter of a pill or something like that. But keeping in mind how low of a dose we have, side effects in general have to do with those patients who were on it for high blood pressure. So my little old ladies, maybe once or twice a year, I'll have someone who had like heart palpitations, and that means she was on it. And at some point I should have lowered to the dose, but she was probably doing so well, I only saw her twice a year and she had a heart palpitation. Other than that, we see no side effect. Well, no, we have maybe once or twice a year. Again, I'll have someone who has ankle swelling with it, and we just lower the dose. So to put it in perspective, I probably prescribe minoxidil 5 times a day, and we have complications with it maybe 3 to 4 times a year. But there's literally nothing I can prescribe that doesn't have a side effect.
Well, thank you so much, because there is nothing actually that don't have side effect. In fact, if you drink too much water, you will find out a hard way that water do have side effect when you drink too much of it. So anything we take have side effect, and it's always best to have a physician guide you as to how and when to take medications. Excellent questions. Somebody asked how they can get this presentation by email. We don't send presentations by email, but please go to our YouTube channel and you will be able to view the whole presentation from beginning to end, plus the Q&A, question and answer session on YouTube. I've put the channel on in the chat box, Medical Mondays with Dr. O. When you go to YouTube, you will see Medical Mondays. There are tons of Medical Mondays. Put with Dr. O and it will take you to that channel. Subscribe to the channel, enjoy all the past episodes. They are now there. A lot of people have been asking for the past episodes and they are now there. The ones from March 1st will be there hopefully by the end of this week, from March 1st. So if you have any other questions, please contact me, private chat me, email me, and I will be able to guide you on that. So another question, why does most hair loss affect Black people more than all other races?
So it is possible that that's the case. It's possible. But I think one reason why, well, a couple of reasons why. One is CCCA, as we just mentioned, is getting worse with each generation. Whereas most of the forms of hair loss, it skips generations, it's not genetic at all, or it's kind of stable. What happened to the father happens to the son. The other reason is a lot of times, in order to camouflage, in order to hide the bald spot, we'll go ahead and use traumatic hairstyles that then cause the traction alopecia. And that's where we've pulled or ripped the hair out of the scalp. So I think one, the nature of the genetic characteristic of CCCA, and then two, how we're a little bit, we don't let our hair grow the way it really should, right? Which is kind of curly, and straighten it. And then, relaxers, the stuff that relaxers are doing to our bodies, that's also a whole added thing to it. And then the last part to that question is, at least in the US, dermatology was considered a luxury. So Blacks didn't have access to dermatologists, honestly, and hairstylists were the hair experts, which is a bit of an unfair burden on hairstylists in our community. And so there's a lot of myths and things that simply are not true that we all thoroughly believe, like greasing our scalps. That was something we just kind of culturally figured out how to work with dandruff and itchings and things like that, opposed to going to a dermatologist. Nowadays, if you name the state, there's a dermatologist that specializes in hair loss and knows your hair. But I think that's why it's just so widespread in us, those 4 or 5 reasons.
Fantastic. Somebody is asking, what happens when you have alopecia over 15 years? I guess, and I'm following up with that. I guess they're asking, can you still do something about it? Or the window to intervene is gone?
Okay, so to put in perspective, I've had CCCA for 19 years. So there's certainly stuff that you got, that we all could do. It depends on the severity. If you have alopecia areata, which I did not cover, it seems to be if we don't get the alopecia areata under control within 10 years, then our success rate plummets, just absolutely plummets. What we really, it's not really how long you've had the form of hair loss outside of alopecia areata, so much as it is, are the follicles dead or not? And if you know, some men, their hairline started kind of receding, those little, you know, right here, these little corners, back when they're 20, and they still have hair in their 50s. So it's not so much of a time, it's a matter of whether or not the follicles are dead.
So you said you have CCCA yourself?
Well, at least as far as I think back since I was 25. So
Your
about
hair is
19 years.
absolutely beautiful.
Ah, thank you.
Thick, rich, beautiful.
Thank you.
So this is testament then that, you know, there's hope for us. So what do you recommend? You know, we do routine health maintenance where we go to the primary care doctor, people come to people like me, and we check everything that we can check to make sure that we are in good health. Would it be reasonable to visit you as routine healthcare just to see the state of our hair as a specialist, someone who specializes in hair?
That would be reasonable if there were enough of us who did, right? So to put in perspective, my next hair loss appointment for a new patient is April. And those are just the ones with hair loss, right? Like with active hair loss. So if you can imagine, people who don't have hair loss are also scheduling appointments, then it's not efficient. What I recommend is kind of like what we recommend for, well, not to go on a tangent. What I always recommend, when my stylist actually recommends, is it's called check your center part. Part your hair down the center. And if you start to see the parts widening in certain areas, definitely come in and see a dermatologist who specializes in hair loss. If you part down the center and you don't see it and it's nice and tight and parallel, then usually you really are okay. What my stylist, the part down the center is something we've always done, but my stylist started it as a campaign called Check Your Center Part. And that's something that your stylist, and when you do your hair, you should be doing it on some kind of regular basis. Parting your hair down the center and seeing if it's starting to widen in certain places, looking like a Christmas tree.
Thank you. Thank you so much. That is excellent. I'm going to start parting my hair. I never did that. You know, people are excited here. They giving you accolades, thanking you for
Thank
the
you
great
all.
information. Yes. So somebody asked, what is the best OTC medication for hair growth?
The best one, now full disclosure, because I do from time to time do a talk with them, do an IG live with them. I've looked into doing research with them. I sell them and the competitor, and it's Nutrafol, Nutrafol. I can put in the chat box my my links. I think if you go through my link, you'll get a discount. So I'll definitely pull that up. And then the catch, remember, oh, by the way, everything that actually works for hair loss has a catch. If it works for hair loss and there's no catch, it doesn't work. So the catch with Nutrafol, and its competitor Viviscal Pro, is that it contains biotin, and biotin doesn't work for hair growth. Nutrafol has the biotin in there because they want to include all of the micronutrients that aid in making hair and helping it to grow, and stress and gut health, etc. But some people think biotin actually makes it grow. Biotin messes up lab results. So when you go to get your blood work, the results will come out incorrect. So if you were to start Nutrafol or Viviscal Pro, not under the supervision of a physician, you will have to remember to stop the Nutrafol, a week before you get your blood drawn. Because if you're not thinking about it and you don't tell your physician is going to make decisions off of results that are incorrect. So, but the best one I think is Nutrafol.
Fantastic. So specifically, what lab does it affect? The biotin, the Nutrafols, what lab do they affect?
So I think that we are still discovering all the labs. One is it can skew your thyroid panel. And what's unfair about that is, as you guys know, thyroid disease can cause the hair to be brittle, dry, and cause breakage. And so that patient is likely to take hair, skin, and nail vitamins, which is based off of biotin. And then if for whatever reason, the doctor says, let me check your thyroid for whatever reason, and the patient's taking biotin, the results come out normal. It can make cardiac enzymes elevated. You're healthy, but you look like you're having a heart attack. It can mess with cortisol levels. It can mess with a lot of vitamin D levels. I think any hormone, it might mess with. So you have to wash it out for at least a few days. I just tell my patients a full week.
That's actually very helpful, because I think it's something that we primary care physicians should at least be asking. Mm-hmm. Are you taking any over-the-counter medications? Are you taking biotin?
Right.
And Nutrafols before we, order labs. Thanks for that information. I have Dr. Oluyemisi Famuyiwa here. Excited to have you on here. She's a regular speaker. She's here at least once a month to give us, oh my gosh, amazing information on fertility, fibroids, and stuff like that. So she has a question. She says, how often do you recommend Black women shampoo relaxed hair versus braided hair? You said something about relaxers not being good for us. But she's asking, how often should Black women shampoo? Or Dr. Famuyiwa, would you like to ask that question? I don't want to put my own 2 cents in it. Can you unmute and ask that question, the question you're asking yourself?
Yeah, thank you so much.
Thank you. Hi. And welcome.
Thank you very much. People have questions, or you have patients who have braided hair that they braid for like weeks on end. I'm like, I don't think that's healthy. Or they have relaxers in and they don't necessarily want to shave it off and go to braided. I know that a lot of people are going to natural hairdo on. And you hear the hairstylist saying, well, try to shampoo it every 2 weeks. And then some women with braided hair say, well, we leave it in and we just wash it with the braids. I'm like, I don't know if that's necessarily better. Or someone leaving their braids in for like 3-4 weeks. Well, what are your opinions on that?
So we have to recognize the reason why we don't wash our hair as often when it's braided, because the time, effort, and money it took to pick it, to put it in, how difficult it is to take it out, and then we don't want it to look frizzy. We didn't decrease the hygiene part for any health reasons. So for our hair, it's actually best if we wash our hair every 1 to 2 weeks. That's just across the board. And then we cheat a little bit when we have braids in to make it last longer, but that's a cultural thing. Medically, it's every 1 to 2 weeks. Now, if once it's summer, we get our hair braided and we don't wash it every 1 to 2 weeks, I mean, we get a pass. It's probably not too detrimental, but we can't let it get it out of hand. And the first way you know it's out of hand is the seborrheic dermatitis is out of control. The dandruff is out of control. That means the yeast, Pittosporum, was allowed to build up and generate inflammation on the scalp, causing the scaling, the flaking, the itching, etc. And then we see it come down onto the face. And it's like, it'll be your 47-year-old patient come in saying that she suddenly got acne. She didn't suddenly got acne. she got a folliculitis caused by the yeast. So it's a balance between culturally what we can do and just hygiene.
Thank you. Good answer. Thank you.
Thank you. So somebody's asking if hair can be restored if one is diagnosed with alopecia 20 years ago.
If you have follicles.
Also lost hair in the eyebrows. So they have alopecia and they lose hair in the eyebrows. That's something different.
Okay, so there's a few things that can do that. And if the hair loss was like a band of hair loss that was moving your hairline backwards and it destroyed your eyebrows, that's frontal fibrosing alopecia. It used to be rare. We're seeing an increased incidence of that. That one, I can't even recover it if you only had it for 1 year. That's the one form of hair loss that keeps me humble, because the best I can do is pause it. If you have the androgenetic type or CCCA, which also can thin your eyebrows out some, then there's a chance, so long as there's follicles still present. So it depends.
Thank you. Is alopecia hereditary in men?
Yeah. You said, is alopecia hereditary in men?
Yeah.
I think somebody answered for me. Absolutely, yes.
Yeah, and that's Auntie Lara, Madam VP. She did. Somebody else asked, does nutrition and environmental factors play a part in hair loss or growth?
Somewhat. It's a little bit unfair. You have to be severely malnourished, and yes, you'll lose your hair. But eating healthy, believe it or not, doesn't reverse hair loss. Now, it should go both ways if things were fair, but they're not fair, right? It's kind of like if someone came to me and complained about the color of your eyes, no matter what you eat, your color of your eyes is the color of your eyes. So for some of these genetic forms of hair loss, no matter what you eat, you have this form of hair loss. I have vegan aerobic instructors with hair loss. Having said that, healthy diet, drinking water, exercise, good sleep are the foundation for all of our health. Like, that's always important, but it doesn't stop some of these genetic forms of hair loss. What's unfair is you could do things to worsen hair loss, but doing those things better doesn't reverse hair loss. And that's so unfair. So here's another way to put it. You can be incredibly stressed and your hair loss will get dramatically worse. Take someone with hair loss, now have them meditate, do yoga, be healthy. It's not going to increase hair growth. Just absolutely unfair. Absolutely unfair. And I think the reason is once you have a genetic form of hair loss, your body wants you to go bald. So you could do things that make your body really worsen it. And then if you're doing everything right, your body wants you to go bald. So what that means is we really have to go up against what the body does to stop you from going bald. So be healthy, be very healthy, because being unhealthy makes it worse. But for some of these genetic hair loss, it just has to be respected as a medical condition, and it needs a medical intervention.
Thank you. Madam VP, all the way from California.
That's where I'm
You have
from.
your aunt, yes.
Hi, thank you. Hi, I had a question. I had two separate questions. First one is about hair, actual hair removal. So what are your thoughts about laser hair removal and hyper versus hypopigmentation that comes along with it? Is it okay? Do you think that this is something that is reasonable? Or should we as Black women use the over-the-counter stuff? Because I find that a lot of times people have like the burning, Black women have the ingrown hairs and all of those other things that come along with it. So what are your recommendations for hair, like actually getting rid of hair?
Yeah, laser hair removal is great. What's unfair is not everyone is trained in dermatology residency on lasers, and not everyone is trained in dermatology residency on Black hair and skin. So what's really, really important is everything has to line up, right? It needs to be the right dermatologist, the right training, the right laser, etc. All of that needs to line up. So we do laser hair removal absolutely every day in our office. And the one time I burned someone and she had hyperpigmentation, it was actually a friend of mine, and she's a Medi-Peds doc. And I burnt her, actually. It wasn't even my nurse practitioner. And it was because she had makeup. And I gained so much respect for Fenty makeup. I couldn't even tell she had makeup on, and she wasn't thinking. And I lasered her with makeup on. And now she's thrilled because I did so much to repair the damage that I did do, that her face looks flawless. It looks better than it ever did because I felt so bad. But you have to have the right laser and know Black skin. We can get just as great results without side effects.
Second one is involving pediatrics. I just kind of segues that for kids or peds who have rashes, like diaper rashes and everything, and you're using the over-the-counter Desitin, but it's not working. Do you have any like recommendations in terms of upping the solution for getting rid of the rash?
Absolutely. So just if I could cover prevention first, we actually love Vaseline, believe it or not. And they have to get like the big jars of Vaseline and just literally scoop it out. And then every diaper change, just take a thick layer of Vaseline, because it's doing two things. It's stopping the friction and it's protective barrier, which is what the Desitin is trying to do. And so for my moms, where I have them just use thick layers of Vaseline, we get no diaper rash. And it's cheap and it's accessible and it's not toxic, etc. The next thing is if there's a yeast infection, then you're gonna have to use, we prefer ketoconazole cream for candidiasis. And then we love putting a little bit of vinegar in the bath water, because that water will pull the vinegar into every nook and cranny and kill yeast, fungi, and bacteria. And then if it's seborrhea, right? So obviously if it's a kid with a cradle cap, what looks like baby acne, and then they'll usually also have the intertrigo in their neck, under their arms, and in the diaper area. Then the mom can just lather some ketoconazole shampoo and use that to put on those hot spots.
Sorry, just for a little bit more clarification, is it like store-bought vinegar that you use? Just the regular
white vinegar. I know like apple cider vinegar is like in vogue or whatever, but regular white vinegar, like the cheapest one you could find. And to put it, for every gallon, it would be about a cup. I'm gonna have, a cup of vinegar.
Thank you.
But nothing's better than a thick layer of Vaseline with each diaper change.
Prevention is always better than cure. Yeah. Thank you for starting there at prevention. Let's prevent instead of, trying to find solution or treat. Excellent. So somebody asked if masturbation can cause hair loss in men.
No.
And another person asked, is there a correlation between hair growth and nail growth? If so, why are my nails strong and healthy, but my hair is thinning out? Dr. Kindred. That's a very important question.
Right. That's such a great example. Because the nail is keratin and the hair is keratin. They're generally on two different paths. This is a great example. You know, you can do things where you're malnourished, you're not healthy, you're eating bad, your nails won't grow, your hair won't grow. And then you do things to be healthy and better, and your nails will grow and your hair won't grow, right? It's just something about hair that's so stubborn. So the link is you can do things that make both worse, but very easily you can do one thing good for one and it won't do anything for the other. So the great point is like Nutrafol is those natural supplements that help with hair loss. It helps your hair to grow and your nails to grow. But say, for example, if you come in and I do a platelet-rich fibrin matrix treatment or the laser with growth factors or heck, hair transplantation, just to exaggerate, it's going to have no effect on your nails. So sometimes there's a link, a lot of times there's not.
So, Sister Lola, are you pleased with that answer? Did you get your question answered?
I guess it's not what I want to hear, but
The unfair part of hair loss.
I have another question about that Nutrafol. Is it medication or is it topical?
It's by mouth, it's oral. I put the link in the chat box.
Yeah.
Yes.
I am very skeptical about anything I take, you know, orally, medication, period. So
I'm very glad you said that because not everything natural is safe, right? And so some people will take the Nutrafol over the minoxidil because they think that if it's natural, then it's not going to have any effect. I'm very glad you said that. So we all need to be just as, if we're skeptical about medications our physicians prescribe from a pharmacy, be just as skeptical about the natural product we buy at GNC. Yeah, I'm glad you said that.
thank you.
So we have Dr. Ashby. She's an internist and also a lifestyle medicine board certified physician out of Yale. She's phenomenal in curing, chronic disease entities like diabetes, high blood pressure, cancer, and stuff like that with diet and exercise. And she asked, she's on the forum, she asked, what natural supplements have you found most helpful for traction alopecia? And welcome, Dr. Ashby. Glad to have you.
Traction alopecia, if the inflammation has not destroyed the follicle, then the natural supplement is actually still Nutrafol. Believe it or not, we found more results with that than anything else. And again, that's provided that you haven't destroyed the follicle. I used to also recommend rosemary oil because rosemary oil has been found to be as effective as minoxidil 2%. But rosemary oil isn't all that safe. We're finding that tea tree oil, lavender, and rosemary oil are all endocrine disrupting chemicals. And that's where when it gets absorbed, it goes in and it behaves like estrogen in our body. And we don't want any estrogen in our body that our body did not make. So now I no longer recommend rosemary oil to be applied to the scalp.
Did you say tea tree oil too?
Tea tree oil, one of my faves, kills fungi, bacteria, yeast. Yep, tea tree oil. So I'm fine with I'm fine with any of those if it's something that we put on the skin and then rinse off, right? So for acne, tea tree oil will be as good as benzoyl peroxide. It takes longer to kick in, but it'll eventually get you there. Lavender, I didn't do it, but I know a lot of people use it to help their babies go to sleep. My thought was, if it's helping my baby go to sleep, it must be crossing the blood-brain barrier. So I didn't do it. And then rosemary oil for hair loss, endocrine disrupting chemicals.
Wow. Thank you. So this person is asking if there is a correlation between high blood pressure medication and hair loss. Basically, does high blood pressure medication affect hair loss?
So the short answer is yes, and so what? Right? We are not trading in your hair for your heart. We're not going to decide, oh, let me have a stroke instead of going bald. But what blood pressure medications do is they'll cause shedding, right? So you should see your hair shedding and replaced by new hair. You should feel like your hair is getting thinner, but there's still hair there. It causes telogen effluvium. That's the same kind of like postpartum hair loss. Same thing if you were on a fad diet, or if you came out of the hospital, or COVID hair loss. Those all cause shedding or telogen effluvium. But if you're getting a bald spot, you need a biopsy. We need to figure out what is actually your diagnosis. What's unfair is a lot of times these forms of hair loss, androgenetic hair loss, CCCA, for a lot of us, it kicks in 30s, 40s, 50s. And for a lot of us, it's also when blood pressure kicks in, and we try to blame it on that.
Great point. I'd rather stay alive than up here. I mean, is the bottom line.
Yeah, thank you. Yes, yes.
So someone asked, how does the minoxidil affect the male or female reproductive systems or other treatments?
Horribly, horribly, horribly. So we don't, I literally ask my patients, women of childbearing age, do you plan on getting pregnant in the future? They say yes. I don't prescribe it. It's just not worth it. The baby can be born without genitalia. To be just very blunt, and that way, it's a no. Males, we're not seeing anything happening with male patients who take it, or with female patients who take it, but it's really the baby.
Thank you. Oh, somebody liked and subscribed to the YouTube channel. Thank you. So another question says, what medical treatment help with CCCA? Any home remedies that help?
Ooh, CCCA is so past the home remedy. That is a gene you're going up against. And there is yet to be a home remedy that can go up against a gene that is triggering inflammation to flood your scalp. So the medical treatment is, we do things, as I did in a presentation, things that make the hair grow. That's the shampoo, the Nutrafol, and then provided that the patient is convincing for me, then minoxidil. We, for inflammation, we use a topical cortisone and cortisone injections. Cortisone is what our body uses to neutralize inflammation. So that's why we use the same thing. And we have to create this protective cocoon around the follicle to neutralize the inflammation and stop further damage. And then we use an anti-inflammatory pill. So it's doxycycline, which is at a 200 milligrams. For an antibiotic, we prescribe 40 milligrams. That's just enough to reduce inflammation. And then we also add topical metformin. That was actually discovered by dermatologist Crystal Agnew at Hopkins. And the same way, and sorry to get too nerdy, the same way that metformin increases the PPAR gamma receptors on the cells, so it can grab insulin and bring it into the cell. We found that when a cell loses PPAR gamma receptors, it triggers cell apoptosis. It triggers the cell to die. So when we put metformin in a cream form, it increases the number of those receptors. And so we've kind of stopped the cells from having that programmed death and that permanent destruction. I know that was a little bit scientific-y, but I see there's quite a few physicians on here, so I chose to go for it. So those are the medical treatments for CCCA.
So what I got from that is, this is not something you can treat at home. It's best to get a physician who is certified. This is a blessing for us. You have dermatologists, and then you have somebody like Dr. Kindred who specializes in hair. This is a treat. This is not your ordinary dermatologist. So what my take home from that is that you go see Dr. Kindred, somebody who knows what they're doing. And there aren't many of them. That's the unfortunate thing. So Dr. Kindred, I made my case, for the next question is what I just did, because I have one of our precious participants, Mr. Yekomi, who have tried the laser technology for a bit, but it doesn't seem to work for him. He's asking for your address to contact you for follow-up. And I want to put in a word that I know that you're booked till April, but I'm looking for an appointment for him before the end of August, 2021.
Before the end of August?
2021.
This month?
Yes, I don't know what his schedule is. I'm just putting in a word. His question is for you to please put in your contact information. If you please put that on the forum. I know there are many people who want to follow up with you, but he wants to follow up with you. And I'm just putting in the word that you should please get in quicker than April 2022.
Okay, when you guys call Miss Rochelle, who answers the phone, be nice to her, because I do these talks and then she get bombarded with calls and then people get frustrated. So just be nice. What I did do was also put in the names of some colleagues in Maryland that are also great with hair. I put it right in the chat box. Dr. Krista Agu, Dr. Valerie Callender, and Dr. Madeline Gaynors. What's great is Dr. Gaynors just opened up her practice this year. So she has a ton of openings. Mm-hmm. And she specializes in hair for sure.
Okay, did you put that in the chat box?
I did indeed.
Okay, I missed that. I think I'll get to that and save those to put it in our email list. So a question is, will you also be discussing skin issues? So Dr. Kindred, our participants are asking you to come back.
Okay, it'll be fun. This has been so fun. Thank you guys.
Thank you. Thank you so much. We have excellent participants. We like family now, actually. That's what it feels like.
Oh, nice.
It's fantastic. Another question is, are there natural ways of treating some of the types of hair loss you talked about? Things like food and natural oil.
Okay, so there has yet to be a food that you eat and it safely makes hair grow, provided that you have hair loss. We covered Nutrafol, so I'll move on, and their competitor Viviscal Pro. Those are the two that actually works. Rosemary oil works, but it's fallen out of favor for me because it's an endocrine disrupting chemical. And then anything with antioxidants helps, right? And there's a lot of stuff with antioxidants. I don't know, carrot juice, castor oil, etc. But if you have a form of hair loss, that is not going to work. Again, it's a medical intervention that needs, it's a medical condition that needs medical intervention. I do use natural stuff. I literally use natural supplements and even your blood, but it requires a more comprehensive approach than that to reverse the hair loss.
Fantastic. So there's a question here that, is there a way to determine if hair follicle is dead? And I think the answer is yes, but I'm gonna.
Yeah, I always recommend for all of our patients, I go ahead and take the time to do a biopsy. A lot of my colleagues don't, because when we look, usually when we guess, we're correct, right? Me and any of my colleagues, we're correct about 90% of the time, but it's not about, you guys aren't a test for us to get an A on, right? You're not another test. We need to be 100% right so we can make sure we're doing the right thing. So I always do a biopsy, and I pick a spot that's like not the worst, but not normal, right? It's like an active zone. And I biopsy that spot. And I usually can, my pathologist will tell me if there's scarring. If it's scarring, that's permanent hair loss.
Thank you. So Dr. Ashby here commented that it's a great tip on the center part check. She definitely seconds that. And for people who came in a little bit later, can you please just, go over that again, the center part check?
Yeah, so the way to just screen and see if you have former hair loss as early as possible, just part your hair down the center and see if you see any parts that are kind of widening. If your part down the center is parallel and even all the way down, then you're okay. Do it again next month or next year. And hopefully you can really just tell your stylist, part your hair down the center and check to see if there's any exaggerated areas. And we do that on a regular basis for years. My stylist started the campaign, check your center part.
So that question was asked by our, by Andrea Harrison, who, can you unmute yourself, please? Please show your face. She is an amazing.
I didn't really want to show my face, Dr. O.
I know you wouldn't want to do that, but I have to put you out there because of the great work you do for all of us as a populace. Andrea Harrison was chair of the Prince George's County. Andrea, help me introduce you. Prince George's County Council for several years. And now she's one of our delegates in our corridor in Prince George's County, and is actually the reason why our nonprofit organization is still open, bridging the gap in that corridor. That's Andrea Harrison. I had to ask a question, even though she said, I think I came late. I don't know if we've had this question. I said, we have to ask it.
And I am a victim of alopecia. And I don't know what kind. So when I come in for when I go to my primary for my annual visit, we're gonna have a conversation about this.
Excellent, excellent.
Actually, we're going to defer to you, Dr. Kindred, to help take care of her, because she also had a backup question. What about hair loss in the eyebrows? And what you told us about that before she came in was not too positive. So please respond to that. Okay.
Yes, so about 3 different forms of hair loss can affect the eyebrows, but if it's the type that's like a headband form of hair loss, kind of moving your hairline back and also destroying your eyebrows, then that's frontal fibrosing alopecia, which is the toughest form of hair loss. It's the one that keeps me humble. And at best, I can just push the pause button on it. And a lot of times all we can do is slow it down. But the other forms, CCCA and genetic alopecia can also cause thinning of the eyebrows.
Yeah, we'll have a conversation.
So yes, proper evaluation needs to be done. And Dr. Kindred, I'll be calling your office personally. So thank you so much, Andrea, for coming.
Thank you.
And so there's another question here, rather, that's I just enjoyed this question. It says, so Dr. Kindred, what do you do for your hair? I imagine having CCCA for all the years, your hair would be gone by now. But it seems you're doing something right. So please share. And you know what? I agree with this, with the person who asked this question.
Thank you guys. So I still remember I was about 25 and I was combing my hair and it was just coming out like in clumps. So for years I didn't do anything because I didn't really know what it was until I was in dermatology residency. So I used the Healthy Scalp shampoo, which is our shampoo in the office. The shampoo in the pharmacies work, but they weren't made for Black hair, and they're damaging, and it dries it out and it causes breakage. So where you can get that shampoo, if you guys want to use the same shampoo that I use, is dermamyth.com. And it allows you 6 months, costs like 30 bucks. So that's the shampoo that we use. In the wintertime, we do a steam treatment. My stylist has this wonderful procedure that she does where she uses a herbal rinse. And this herbal rinse, she makes it into a tea, and she just kind of rinses your hair through and just leaves it on. And I really feel like it's probably strengthening the hair some. And then, so those are the things you can do on your own. Medically, I have either my medical assistant or my nurse practitioner do my scalp injections. I use that combination of the metformin and cortisone. I take doxycycline, 40 milligrams. That's the anti-inflammatory dose, not the antibiotic dose. And then depending on which way the wind blows, I'm taking either the Nutrafol or their competitor, Viviscal Pro. Years ago, I did do PRP. And then sometimes I do the laser where we add the growth factors with it. Now, I don't do any of that diligently, right? Because doctors are not known for being good patients. They're known for being bad patients. But there's always some kind of combination of something that I'm doing. But I don't even take full advantage of what I have in the office. Sometimes I wish I could just leave it alone, just let myself go bald. But then y'all wouldn't believe me if I come in bald headed. So that's why I treat myself just enough to have enough hair so y'all believe me.
Thank you so much. That was loaded. Thank you.
Thank you. Thank you so much. So a question here is asking if one would need to get a referral from primary care doctor in order to pay for a visit to you. And I would answer that question. It depends on your insurance. So if you have PPO, I think it is, then you can go to any specialist you want and any physician you want. But if you have HMO, then you need then you need to get a referral from your primary care doctor before you see a specialist. Dr. Kindred is a specialist. So another question, that's the same one. Dr. Ashby asked, FSH, LH are also affected by biotin. Dr. Ashby, yeah. I'm going to please ask you to unmute to comment. Dr. Ashby.
Hi, everyone. Thank you so much for this wonderful presentation. And I'm here looking at the website and the healthy shampoo.
She's already there.
Copy paste. So, and also, I looked at the ingredients for the Nutrafol, and there's a lot of natural ingredients there too.
Yeah, they legitimately have a 100% natural product. A lot of these companies don't, and they're very like transparent. They're good people.
Yeah, I was happy to see vitamins A, D, C, and all of the curcumin and spices.
Yeah.
So it's nice because I go straight to the actual ingredients when I'm considering something natural. So it's great, yeah. And biotin oftentimes is something that we forget to ask our patients to refrain from before a blood test, but it does mess up a lot of tests, including the hormonal panels for sure. Yeah, thank you. That was a wonderful presentation.
Thank you. I As a primary care physician, I am so grateful for that information because I'm going to keep an eye out now and make sure I ask specifically, are you taking biotin? Because you ask your patients, what medications are you taking? Any over-the-counter medications, and sometimes you have to pull it out of them.
Yes, yes.
Because sometimes they don't even remember, that they're taking that.
Absolutely.
So somebody asked, thank you so much, Dr. Ashby, for that contribution. And somebody asked, how long will someone need to use Nutrafol?
It's not a cure, right? So if you could use it for a particular amount of time and then stop, and then maintain those results even after you stop, that's a cure. We don't have a cure for hair loss. So you would have to continue it so long as you want the effects, the positive effects of Nutrafol. Yeah, as long as you want it to work, you'd have to continue. It takes at least 3 months for you to see the effects, though. Maybe that's also part of the answer to your question.
Fantastic. Thank you. Somebody is asking if stress factors affect hair loss.
100%. It does. Stress worsens it for a few reasons. One is when your body is stressed, it pulls nutrients away from organs that are not important. And follicles are micro organs. So it'll pull nutrients away from the follicle. And then stress increases levels of inflammation. And we think that might have something to do with some of these forms of hair loss. Stress 100% will worsen it. And what's unfair is anything that's de-stressing or anything that's anti-stress doesn't make hair grow. That's the part that's unfair.
Jeez.
Mm-hmm.
So someone else asked, how do one fix hyperpigmentation?
101 ways. So if we just look at what I have in my office, the first thing we want to know is we want to figure out what caused the hyperpigmentation. So hyperpigmentation is just dark spots on the skin. If it was caused by acne, we're first treating the acne. And then a lot of times we could do nothing and the hyperpigmentation will resolve. If the hyperpigmentation is melasma that's, say, hormonal, then we need to wait till the pregnancy's over or take you off the birth control or whatever that may be. But let's just assume we're talking about a dark spot left from something that's no longer present. It's quiet and something left its brown footprint on your skin, like a mosquito bite or a cut or an acne that you no longer have. So the first thing we do is protection. And so we give you a medical grade sunscreen. Over-the-counter sunscreens that you can use is CeraVe AM. That's a good sunscreen. Dermablend have great sunscreens that blend in with our skin. And you want it to be SPF 30, broad spectrum, water resistant, and antioxidants and protection against the blue light from all the screen time that we're getting. Again, SPF 30, broad spectrum, water resistant, antioxidants, protection from lights indoors and from blue lights. So that's protection. For treatment, we have plant-based facial washes that help. PCA Skin makes one. You can buy it over the counter. I think it's $50 and it should last you 2 to 3 months. We use serums. We use amino acid-based products. So there's topicals that do it. Hydroquinone does do it, but you have to be careful because it'll bleach your normal skin. We do chemical peels. They're great. We use lasers all the time for it. Those are wonderful as well, but even more so, we tend to combine these things. So in Black skin, you can't take any of those one things and crank it up, right? It'll backfire in our skin. So we want to take a little bit of this, a little bit of that, and combine it, and the results are actually even better when they're combined. So we all the time combine a sunscreen, a cream, laser, and chemical peels all at once to get fast results without any adverse effects.
So, thank you. I want to reiterate that we are not to take biotin, right?
Thank you.
Thank you. You know, there's another question about plain biotin. So I wanted us to, reiterate that. No biotin. So Dr. Ajagbe, a dental pathologist, asked, are you familiar with the use of MSM? That's methyl sulfonyl methane.
Yeah, methylsulfonyl methane.
Yes, and magnesium ascorbyl phosphate affecting hair loss and hair growth.
So methylsulfonyl methane, or just MSM, it does work. It does make hair grow, but the safety studies show that it's only safe to take for about 12 weeks, up to 12 weeks at a time. And then you need to stop. There's no safety data after that. There's none that I've seen. And it can cause nausea, vomiting, diarrhea, headache, and interact with certain medications. Just a great example of not everything that's natural is safe. So I generally don't recommend it because almost every form of hair loss I know of lasts longer than just 12 weeks or 3 months. With the magnesium, that one interacts with certain medications. And since I don't have to worry about that with the Nutrafol and the Viviscal Pro, I tend to just, those two are my go-to, and they have the best evidence as far as how well it works.
Dr. Jagwe, are you pleased?
Yeah, thank you.
Thank you.
Oh, I should mention the magnesium and the ascorbyl phosphate. That's basically vitamin C, and vitamin C is better absorbed if it's attached to magnesium.
Okay, so I have a question that was, private chatted to me, and the person said she's sorry because this question is not about alopecia, but that at the age of 15, she was diagnosed with sarcoma and have small bumps in her armpits, groin area, and neck. She does not sweat. And when she's overheated, these areas are very itchy. They look like eczema. What natural remedies can one use? I would rather ask, what can one use? Because sometimes there are no natural remedies yet. But she said, what natural remedies can one use?
No. And to be truthful, there's almost no medical remedies. It's syringomas. So syringomas, syringo, or if a gland, it's like that. The gland formed its version of a mole, and it just looks like skin color bumps, a bunch of small skin colored bumps. Very commonly, they will be like right on, the lower lids, but also in the areas that she mentioned. And it's tough. We have to destroy them. We literally either freeze them or we burn them, and they're very resistant, very tough. Just a very unfair condition to have. So I think she should just go section by section with the dermatologist, and they just try to destroy it. It itches because the sweat is blocked and it's not allowed to come through the packet, the pore. She either has syringoma or eccrine hydrocystomas. I'd be very curious if she had a biopsy that told her specifically which was which.
Yes. But either or, it's still the same intervention, just to try to
destroy it.
Okay. Thank you. So Dr. Caspi is asking what medical journals are providing information that oils are endocrine interrupting. Like I think rosemary oil is what she'll be referring to, I think.
Yeah, I would definitely consider reading the research, not a journal, but this one scientific researcher, Tamara James Todd. I'll put her name in the chat box. She was the one that brought such things to my attention. She was the first to look at hair products and its effect on pregnancy. And she started this about 10 years ago when everyone poo-pooed her and said it wasn't important. And now, look, we're now investigating benzene, the cancer-causing ingredient in sunscreens. It's just such a thing now. But you can find that in which journal? Oh, she applies to a lot of journals. I would do a PubMed search. I'm assuming since they asked about a medical journal, that is a physician. So literally you could just do a PubMed search and put in endocrine disrupting chemicals plus essential oils. There's been a few good review articles. Maybe start with that one and one of those and then work backwards from there.
Fantastic. Thank you. So our attorney, now we're switching gears from doctors now to lawyers. Marsha Edwards, my sis, she says, in what dosages do essential oils, rosemary, tea tree, and lavender individually begin to have adverse effects on one's body? And how often would they have to be used before the adverse effects become evident? She also says,
sorry.
She also has a follow-up question. Should I wait on that?
No, sure. I might be able to
put it together.
Yeah.
She says also, what are the adverse effects, if any, from Nutrafol and the other new treatment you referenced?
Okay, the second one is easy. So again, it has biotin in it. And you have to stop your labs a week before getting, stop the Nutrafol a week before getting labs done. You can't be pregnant on Nutrafol, and you can't have blood clots with these two treatments. As far as which dose, that's the part that's hard. And it's kind of something I'm sure a lot of us MDs, which like the naturopathic practitioners would do. So little by little, the MDs are doing these studies, but it's not too ethical to say, I'm gonna put this oil on your skin, but I'm gonna give you a little bit more because I want to see if it causes damage to your ovaries. Like, we can't do that. And so that's what makes it so tough. So the way that they pull these things out, the same way they figured out that, arsenic is poison, is you have to look at populations. It's more like a population health thing. And you look at groups that give a history of using these things on their own, not because the doctor told them, and then correlating it with comorbidities. It's a really, really hard thing. It's a really hard thing to do, but there's tons of researchers working on it now. And it's not like anyone's going after natural products. Okay, so for me, as you can tell, I'm a proponent of natural stuff and chemical stuff. I really don't care, to be honest, if it's natural or not. I'm concerned if it's toxic or not. That's where my line is drawn, is if it's toxic or not. There's some things that are toxic are natural, are chemicals, and some things that are non-toxic are natural and are chemicals, but that's how I differentiate it.
Fantastic. Thank you. I have several people saying that you please have to come back for hair, for skin, and they said there are so many questions, and I think they're feeling that they don't want to overwhelm you. They don't know how energetic you are. They can ask their questions. So, so somebody asked if insurances cover your treatments, when they do make it to your office.
Mm-hmm. Very important question. And it's some yes and some no. So I had to make a choice, just like all the docs here. I had to make a choice. For me, it was in 2018. Do I want to just offer what insurance covers? Or do I want to offer everything and then let my patients decide what they want? And I chose to offer everything and then let my patients decide. So some things insurance cover and some things it doesn't. But when you come for that hair loss consultation, I set aside 30 to 45 minutes. And well, let me back up. I literally am drawing a follicle. I'm drawing a normal follicle. Then I'm walking you through the disease process. And then we go over the treatment options, their side effects, what's covered by insurance, what's not covered by insurance. If it's not covered, I literally write the prices down so that when we get to that point, you've known all along what the prices are. So some is covered, some is not. The catch is insurance companies are allowed legally to call hair loss cosmetic. That's what we're up against.
Wow. Wow.
Mm-hmm.
They think hair loss is cosmetic.
Mm-hmm.
Interesting.
Mm-hmm.
So that will make it so that a lot of things may not be covered.
So yeah, some things, particularly if I'm whipping out stuff like technology stuff, the laser with growth factors, using your blood, that's not going to be covered. The minoxidil is. What's good is a lot of patients can use their health savings account or their flex spending account for all of it.
Yeah, that's true. So is turmeric good for the hair and for itching?
What's the beginning part again?
Is turmeric.
Oh,
turmeric.
That's what I was trying to think of when I was talking about antioxidants. Turmeric is now what's in vogue. Turmeric is now what's in vogue. It's an antioxidant. So if you have a little bit of inflammation, then, yes, what I don't like about turmeric, there are some naturopath practitioners who were injecting it as an IV for some patients, and a couple of patients died from it. So there's definitely can be an amount that's too much, but there has been very little data, scientific data, to say that it works. And before your physician is going to tell you to do it, we kind of don't do it unless we see the evidence behind it, and there just isn't evidence yet.
Fantastic. Any thoughts on rice water for the hair?
Rice water won't die. Okay, so if you guys Google how to remove arsenic from your rice, it's literally the same steps, right? You soak the rice in water overnight, and then you throw out the arsenic water, and then you cook your rice. But instead, they're saying pour that rice water, that arsenic water, onto your hair and skin. So even if it did work, I wouldn't want you guys doing it. But no, it doesn't work.
So thank you. Again, no biotin.
No.
Don't use biotin. So I have this question by Dr. Damien Dublin. If you please unmute to ask that question, that would be fantastic. Because I could not piece it together. Causes and treatment of depigmentation and all of that. I couldn't figure out what is being asked or said there. Dr. Damien Dublin.
Good evening. Good evening.
Fantastic. Welcome. Good evening.
This is the first time I'm hooking on, and I want to thank you for organizing this. And the doctor, she's really handling her stuff very well, nice and easy. I like the way she did her presentation. I'm learning a lot. My specialty really is not skin, but I'm a dental surgeon by profession, but I'm interested in these aspects. My question was about depigmentation and the causes, the frequency in blacks, and I'm aware of a product in Cuba which they extract from the placenta. So I'm not sure if the doctor is aware of it. So that was the line of my question. But a very good session, and I'll be following up on the Monday medicals. Thank you.
Thank you very much. Thank you.
Well, my question is, are you referring to exosomes, the stem cell therapy that's extracted from the placenta? Is that the one you're referring to?
Yes, that's the one.
Oh, exosomes, great. So just to bring everybody up to speed, stem cell treatment for vitiligo, for hair loss came out a few years ago, and I just completely ignored it, particularly because the stem cell technology that came out for hair loss contains the DNA of another person, right? And all of us here just need to go bald before we let anybody convince us to inject the DNA of another person into our scalp, right? And what happened is technology advanced, but we realized that stem cell, that mother cell, wasn't doing the work. The mother cell was just releasing proteins into its environment that are like little construction workers and they contain their own building material that are building what needs to be built. And those little construction workers are exosomes. So what they're doing is they're taking stem cells either from the placenta or from the bone marrow. Those stem cells release those exosomes, and then we're grabbing the exosomes because they just contain protein, mRNA, growth factors, lipids, cell membranes, etc. So I don't know what Cuban medicine is doing, so I can't speak to that. But as far as just the general medical community, we're very impressed with exosomes. So the future of medicine, the future of the field of medicine is not from the pharmacy, it's from a cell, right? So that's platelet-rich plasma, where we're using your blood to get hair grow, exosomes, etc. You're gonna find we're gonna get more and more of our solutions and treatments from our own cells and harnessing that power. But it's still in its infancy stages as far as using the exosomes for depigmentation and vitiligo.
Thank you. Dr. Dublin.
Thank you.
Okay, thank you. I wanted to be sure that your question is answered. Thank you. So, Hannah, Dr. Ajay, thanks you so much for this awesome presentation. And she says she likes the answer you gave to the stress question, but will those working more than 60 hours a week increase their risk of alopecia? Will longer hours and more concentrated focus on work be culprit for hair loss? And that would be all physicians, or most physicians.
And hold on, Miss Hannah, don't be trying to take AJ away from the office now. So it's a matter of, it's more so a matter of stress. So if the work is a source of stress, then the answer is absolutely yes. So I tend to, if you combine the community service I do, like things like this, then I work more than 60 hours a week, but I love it, right? I just absolutely love it. Stress probably came from my kids being in virtual school last year, but aside from that, if your work isn't a form of stress, then you're okay. So identify specifically what's the form of stress and then remove that. So if it's work, then the answer is yes.
Fantastic. So somebody asked how to prevent or treat ingrown hairs that happen during menstrual cycles.
Interesting, during their menstrual cycle. So so then that means it's hormonal, and I'm suspicious the asker, the questioner, is referring to facial hair. So if we see just as more irritation around your cycle, and it's hormonal, don't use a razor to remove the hairs, and don't use tweezer. We really have to stop tweezing. We need a Stop Tweezing Black Women campaign, because that string we use to kind of tie up presents with, I forgot what it's called, but that ribbon is the one that you take the scissors and you cause a friction, and then that rubber curls up and it looks really nice. When we use a tweezer and we pull it, the same thing happens for the hair that's on the inside. And now you have a hair caught up in between. So the way to prevent it is actually just laser hair removal. Destroy the follicle before the hair turns gray. Because if you have unwanted hairs, you only have two choices. Either laser it or marry it. That's your only two choice. And once it turns gray, you married it.
Once it turns gray, that's it.
That's it.
Wow. So, thank you.
Mhm.
I'm going to ask Mr. Rotimi Oyekomi to unmute, please, and tell Dr. Kindred what you wrote in the chat box. He called your office already, by the way, just to let you know. Mr. Oyekomi, and he's asking for a code, so he has to ask himself.
Oh, yes, thank you. Are you hearing me?
Yes.
All right. Exactly 10 minutes ago, I did leave a message on the voicemail with my full disclosure and with an authorization from you telling the front desk lady to allow me to have an appointment before the end of August.
Oh, I am going to hear it tomorrow.
So, what's the code?
So I need a code.
I will have, we don't, you guys have me stumped.
I told you you were going to be in for a treat with a fantastic audience.
I'll talk to Ms. Rochelle tomorrow.
Okay, good.
Yeah.
Thank you so much.
Thank you so much.
So, Dr. Jagbe asked again, he has another question about the effects of fidgety habits of pulling on the hairs.
The effects of what happened?
Of pulling on the hairs.
Oh,
pull.
Like, are we referring to people who pull the hair out or hairstyles that are pulling on the hair?
Dr. Jagbe, please unmute.
Thank you, Dr. Kindred. I'm talking about those who are constantly rustling their hands in their hair and not even paying attention to what they are doing. It's just a habit. You see what I'm doing now? Some of them just pull on them, some twist their hair. How does that affect the hair loss that we're talking about?
Excellent. That actually pulls the hair out. The good thing is usually the hair will just come back in because it wasn't as traumatic. So, and the gestures that you made was really important. So sometimes you'll see me all the time doing like this. Sometimes I feel it tickling in my hair and I'll move it back or what have you. A lot of us with long hair, you'll see us flip it off of our neck if we get hot. And that's different than the people that just kind of sit there and mess with their hair.
That's what I'm talking about.
Yeah, that will actually pull the hair out. Because the thing is, our hair is naturally curly, right? Mm-hmm. And then it can be quite long. And if we're constantly pulling on it, if you're pulling on a slinky, a spring, whatever, you can just break it. You can just snap it. We're lucky if it's snapped right above the surface, but if it's in the root, if it happens long enough, we reduce the chance of it growing back in. So yeah, it's minor matter. They have to leave it alone. And usually, studies have found there is a touch, just a touch of OCD in those cases.
Thank you. Mm-hmm. Oh my gosh, that's a very important question. Thank you so much for your answer, also for answering it. Dr. Ashby said she's getting your shampoo. She said, I haven't found a shampoo I've been pleased with yet. Lots of great conditioners, but not many great shampoos. So she's going for your shampoo. So by the time you come back next time, we will have feedback. And
we'll have feedback, yes.
I am getting your shampoo also.
Well, okay, then let me get a little bit more specific. So you want that to last long, right? So you use your favorite shampoo before and after the medicated one, right? Because this one is it's a treatment. if you will. And then always follow up with the conditioner. You want to make sure you leave it on, the medicated one, for at least 5 minutes so it can do its work. It's actually our dandruff shampoo that we found out in 2019 was helping hair to grow.
Oh, wow. So
And
do you have a conditioner you recommend?
she hit it on the head. There's so many great conditioners. There's not a problem there. So I only carry products if I'm creating a solution to a problem. So no, I haven't created a conditioner. It would just be a me too.
Fantastic. So she also said, is that sister logs you have?
Oh no, these are just regular 2-strand twists. I don't know if you guys can see the,
Yeah.
yeah, just 2-strand twists.
Another question says, it's not hair protection barriers, example, armpits. I'm not sure what this is saying. Dr. Caspi, kindly ask your question. Please unmute.
Hello, hi.
Hi.
I wanted to just ask a question regarding shaving of the hair of the armpits. Hair is used as a barrier, is it not, for to keep the absorption of deodorant or any chemicals to actually absorb in the skin? But I know a lot of people, especially in the United States, they shave practically every part in the hair. So I wanted to know your thoughts on that.
So our body didn't create hair for deodorant, right? The
Yeah.
hair under the arms predates deodorant. And deodorant is made to go past hair and get to the skin, even in the containers it has. Hairs, we think, so what happened, the armpit hairs and the hairs in the hairs in the pubic area does this as well. Hairs in the pubic area is to prevent germs from getting in, past that barrier. But for the armpits, it had more to do with, if we're not mistaken, we think with the pheromones. So if the hair traps the sweat, the bacteria eats the sweat and releases a gas, and that gas is body odor, which today we consider to be musty, it smells bad or what have you, but it kind of trapped more of the sweat and it increased it. It's not really a physiological benefit at this time, because the skin still is locking everything out in the armpits. Not the case, right, in the private area, because there's an opening there, so they're not in the same lane. But again, the hair predates the chemicals, so that's not why it was there. Dr. O, I think you're muted.
Thank you. Dr. Ashby follows up that your hair is beautiful and healthy looking. She says, always great to walk the talk. I think that is very important. And thank you. That is so true. We can look at your hair and we want that. And we know you're walking the talk.
And Dr. O, I appreciate your hair as well. Yeah. What has happened is, to not go too deep into this, someone decided what professional hair was, and they decided it wasn't our hair, right? So those of us that are in positions of power, we kind of, when we can, need to wear our hair like this so that we can redefine what's considered professional, what a successful person looks like, so on and so forth. So when I have a speaking engagement, whatever, I do not run out and straighten my hair. I actually, more often than not, will wear a curly afro as much as possible when I'm giving my talk. So I let these twists get as old. Oh my gosh, when the twists are old and raggedy, the curly afro looks even better.
Thank you for that comment. I have seen colleagues of ours who changed their hairstyle from braiding that they did all through medical school or residency and all, because they said it's very important to change to perming the hair so as to fit in. And so thank you for that comment. Some of us will keep our hair the way we're doing it now and just rocking it.
Just
because
rocking.
that's who we are. And thank God, you know, there's beauty in everyone. God created us the way he did because that's who we are meant to be. And so thank you so much for that comment. Dr. Jagbe says, what do you think about coconut hair mask?
It's not a thing. It's another one of those, you know, has a little bit of an antioxidant quality. So you might notice some improvement. Coconut oil was that coconut oil hair mask or coconut? Actual coconut? I could be mistaken. I'm suspicious. I'm familiar with the coconut oil hair mask. Coconut oil at room temperature is a solid. So it takes a little bit of the body away from it, but it definitely seals in moisture. But careful, because some people with eczema can get scalp irritation from coconut oil, but it's fine.
Someone asked if shaving private part with VIT is okay for women.
Yes, just don't get too close to the opening, but it's fine. Again, it's something that is on and then it gets rinsed off. So if it's something you put on and then rinsed off, I'm not too concerned about the ingredients, except for not being allergic to it. It's the leave-on stuff that I'm super restrictive about, but the VIT is fine. Better than tweezers and razors.
Thank you. Someone says she was diagnosed with androgenic alopecia. She's concerned about using minoxidil. What are your thoughts?
So only start the minoxidil if you're ready to never stop it. If you start the minoxidil, you're locked in for the rest of your life. 10 years ago, I would be sitting here telling everyone, start minoxidil, because it was all we had, and it was all we had for the last 30 years. But in the last 5 years, there's been such an explosion of so many great treatment options that I say only start minoxidil if you're ready to be locked into it for the rest of your life.
May I comment?
Yes, please. Please go ahead.
So that was my question. Hi, my name is Tracy.
Hi.
My doctor, she's in Howard County. You might know her, Dr. Wheat. So she put me on I think it's it was something just for me. It's like a compound that's created, and it has minoxidil in it. And I just stopped using it. I do use a topical oil, scalp oil, and then she has me on finasteride. Does that make sense? A blue pill?
So it sounds like she diagnosed you with CCCA, centrifugal cicatricial alopecia, and she's doing injections?
No, none of that. No.
No, but she gave you,
finasteride.
What did your biopsy show?
So my scalp biopsy, so that's what came up. And I think it's androgenic
androgenic
alopecia.
Yeah, she gave you an oil.
A scalp oil. Then this compound which has minoxidil in it. So I just stopped using it.
How long did you use the minoxidil for before you stopped?
So it came in this really tiny valve. It was like $70. It was very expensive, but it got very little. So I want to say I probably ordered it 3 times and decided I didn't want to be committed to the minoxidil. I just didn't. So I didn't use it for long. But I have been on a finasteride pill.
Like for the minoxidil, so was that 3 months?
Yeah.
No, it wasn't even that long. Because it was so little in a bottle that it probably was more like a month.
Oh, you're not locked. That's not long enough really to be locked in. You might notice a little dip in hair loss, but you'll recover. You didn't use it long enough.
No, and I actually didn't even notice a dip. I think what's, and I use the scalp oil because that's the one thing that's covered by insurance and it doesn't cost much. I really don't think it's doing much. I think what's really helping is the finasteride. I can't say that my hair is necessarily growing back, but it has definitely stopped falling out.
That's the first sign that something's is working, is that you see less shedding. So if you can imagine your hair loss is a train going down the track and it's going to fall off the cliff, the first thing that happens before you save it is it slows down, then it stops, then it reverses. So before we'll ever see hair growth, the first thing you notice is less shedding, and it sometimes takes 3 to 6 months. Chances are Dr. Wheat will be sending you to me once she feels like things are stable, because she sends you guys to me for those more like cutting edge.
She said that she was, so you mentioned something about platelet-rich plasma. I recognize that. That's something she said. She said she would send me to a colleague. I imagine it's you. If it looked like what she has me doing is not working. So I have some peach fuzz. It seems I at least don't have the loss that I had. But for example, my hair came below my shoulders. My bangs were like under my chin. And now my bangs barely reach my eyebrow. So I lost a lot of hair. It's thinned out.
Oh, by the way, so this is just for educational purposes, and none of what I'm saying is individual advice for any one individual person. Okay, so what I would recommend is go ahead and make an appointment now, because it would really suck if, let's say in December, she said, okay, time for you to see Dr. Kindred, and then our appointment's in October. She does not know we're booked out to April.
I actually do, my follow-up with her is in December. My next follow-up.
Okay, yeah, I would just go on and cheat and have that in place for April, so when she sees you, you're good to go. I love Chakotay. She's great. She's one of the few dermatologists that really get you guys prepped for those cutting edge treatments that are optional. You guys don't have to start from scratch. Tell her I said hi.
I will. So if this is working, will I need to come to you? Or
you guys can decide. You can decide. It sounded like you had a significant amount of hair loss, so I'm just kind of making an assumption.
I haven't, but she did say when I come to you, whatever it is you would be doing, insurance doesn't cover it.
Right. She's a dermatologist that cannot do, it's not her practice, right? So she has to stay within what they'll allow her to do. So to do right by her patients, she'll then, when she's done what she can, she'll send you to one of us that can just, one of us that is the decision maker for the practice.
So I go on your website and make an appointment. Okay. Thank you.
You're welcome. See you soon. Nice to meet you.
You too.
Thank you.
Hey, Tracy.
I'm so glad you were able to ask your questions and get them answered. And thank you, Dr. Kindred. So someone is asking if there's any benefit to using fresh aloe on the hair.
It's another antioxidant. It's anti-inflammatory. If you like that soothing sensation, then it's great, but it doesn't reverse hair loss.
Okay. So thank you. Another question. Oh, somebody is commenting that they could not find the shampoo on your website.
Oh, they might have missed that that website that has the products. It's dermamyth.com.
Thank you. Mm-hmm. So is your son there? Does he want to say hello?
Right.
He can say hello to us.
I get photobombed about every 20, 25 minutes.
Of course. They are priority. So somebody said, please talk about the wigs, our necessary evil. Do wigs cause hair loss on the edges, or does it not affect the hair at all? this person is concerned about the pressure it puts on the edges.
It absolutely does, especially the elastic band. What we cannot have is, sister wearing a wig and the wind blows and it falls off, right? That's unacceptable. So that's why there's the elastic bands to hold it on rather tightly. But then that, even if it's minor, it causes friction. So we have patients purchase these like velvet headbands. One brand is called the Wig Grip. I'll put it in the chat box. And it helps to protect the edges from the elastic band on which the wig sits so that it's secure. But it certainly is a great example of how you can have one form of hair loss, you camouflage it with a wig, and then you get traction, alopecia that we alluded to earlier.
Fantastic. Thank you so much. That is very helpful because so many people wear wigs these days. Thank you so much. So I just want to switch gears a little bit and acknowledge Ms. Abundance, who has always been on Medical Mondays since it started on March 1st. And we will do that, mention at least one or two people, every now and then who have been with us every program and never missed one. Wow. So thank you so much, Ms. Abundance. If you can please unmute, we just want to acknowledge you if you're still on.
Thank you, Tao.
Thank you so much. Thank you. And I hope you're learning along as we are learning too,
Yes, ma'am.
Thank you. So here on Medical Mondays, we do give gifts to people who bring 10 or more people to the forum and, inform us about it. We call them VIPs. And the champions are those who bring 20 or more people. And Dr. Jagwe is the only one who has done that and, gotten a champion's gift. This week, guess what again? Dr. and Dr. Ephraim and Hannah Ajay, the ones who connected me with Dr. Kindred, are the winners of our VIPs for this week again. And they'll be getting a gift from Marbury. So, thank you so much again for, being there and always being in the background, the co-host, make sure everything is running well in and out of the program. They are gentle giants, people who work honestly in the back doors to make sure things are working all the time. We appreciate you. And I also want to say, if I didn't mention in the beginning, that these sessions are not to establish doctor-physician relationship. These are sessions to disseminate correct medical information with top-notch specialists and giving free care, free advice, and getting your questions answered. And we are grateful for another fantastic session. Dr. Kindred, do you have parting words for us? Take-home message for us.
AJ and Dr. O, thank you guys so much for this invitation. I think what you guys are doing is really outstanding, is increasing awareness for all. I think it makes all of us better. This is a lot more efficient than us seeing one patient at a time, trying to educate one patient at a time. I will hang on for another couple of minutes if you guys want to tell me where you live, and I can maybe tell you who's a really great hair loss specialist, dermatologist in your area. Just so happens I tend to know where they all are. And thank you guys so much for this invitation.
Thank you. So the floor is open. And before then, if you all would just please unmute and let's give Dr. Kindred a round of applause, our Medical Mondays appreciation shout. So,
yay, thank you.
And as well, thank you, Dr.
Thank you.
That was awesome.
Thank you.
Thank you.
Thank you. Thank you.
We appreciate you.
Thank you,
That
Dr.
is
Kindred.
great. Thank you
Thank
very
you.
That
much.
was awesome.
Yeah.
Thank you
You
very
are good.
much. Thank you. Thank you, Dr. O.
Oh, thank
Thank
you.
you,
So much,
Dr.
Dr.
O.
O.
Thank you.
About everybody else enjoying that session.
I see Dr. Veronica, all the way from California also. Welcome.
Hello, Dr. O.
Hello, my sister.
You always rock. Thank you for bringing Dr. Kindred. This is awesome.
I know.
Thank you.
That's so beautiful.
Sister Edna, so nice
Hello.
to see you. Thank you.
Thank you.
Thank you so much, Dr.
Thank
O.
you. This is good.
Perfect. Thank you.
So if you want to ask about dermatologists in your area, please ask Dr. Kindred so that she can give you
Thank you.
information. Thank you so much. Information on dermatologists that are great in your area. Dr. Kindred, somebody is asking about dermatology in Atlanta, Georgia.
So in Atlanta, Georgia, I recommend.
Who responded? Oh my God.
Dr. Cornelius, Dr. Talia Farrow, and Dr. Tiffany Clay.
Did you get that?
Yeah, Dr. Cornelius, Dr. Tafila.
Oh no, honey.
Where in Florida?
Dr. Mary?
Dr. Ash.
Yeah.
Oh, Sarasota. I don't know where Sarasota.
Can you please mute? Everybody, please mute. No, we don't have. In Florida, Dr. Ashby, we're in Florida.
Sarasota or close by?
Okay, I just put in 2 names.
Great, thank you. I've had to refer patients out of state.
Okay. Maryland, what part of Maryland?
Hi, Frederick, Maryland, please.
Frederick.
You have, what's her name? I can see her face.
I think we have Dr. Kindred, right?
I am a little bit far. She might, in Bethesda, you have Dr. Kemi Akingboye.
Kemi Akingboye.
And then that's in Bethesda, which is about as close as you can get. There's one more, and I feel so bad. Dr. Ford, Dr. Diane Ford. Oh my gosh, she is in Frederick. And then I just saw, PG County. PG County is a no-brainer. You guys have Dr. Valerie Callender.
Oh yeah. I know Dr. Callender.
That's a no-brainer.
Yeah.
And then there's a Brandywine. I think that's very, very, very south. Is Brandywine near Oxford?
Brandywine, I think beyond Clinton, Maryland, right?
Yeah, the closest you're gonna get is Dr. Robin James.
Okay.
Okay. All right, you guys. Well, thank you.
It's Upper Marlboro. That would be it's still in Prince George's County.
Yeah.
Yeah.
And that'll still be Dr. Callender. You also have Dr. Charlene St. Seren. They both do PRP, for example. Okay.
In Prince George's County. Okay.
Yes.
Thank you so very much.
Thank you so much for the invitation.
I appreciate you.
All righty.
So have a blessed rest of the week, everybody. We'll see you again next
Thank you all.
Thank you.
Thank you, Dr. O. Thanks a million.
Thank you, Dr. O.
Thanks a lot. Good job.
Bye-bye.